It's that time again. It is time for another edition of the Neishloss podcast. I am your host, Mike Asti, and this one is going to focus on United Healthcare. We touched on it before, but this one is going to focus on United Healthcare in Western Pennsylvania. What's been going on, what's going on now, and what's going to go on with UHC in Western PA. And to do that, I'm going to be joined by Missy Sipusic, who is the sales director with UHC here in Western Pennsylvania. So she's in our home base. We're sharing Western PA with her. So this is a home edition here of the Neishloss podcast, and Missy is here with us. So without any further ado, Missy, thanks for joining us. How are you
Sure.
doing here? First off,
Thanks for having us too. Thank you.
no problem. And do you go by Missy or Melissa? Which one would you rather?
Missy is fine unless you want to yell at me. You can use my full name. So we'll go with Missy.
Okay, and I kind of actually have that as well. I go by Mike usually, but if my mother is mad at me or if even my girlfriend's mad at me, they may drop Michael in.
All
But
right.
normally, normally I use Mike, and if I hear Michael, it's like, what? I kind of turn my head. But okay, so we'll use Missy and Mike for this one then to keep it low key. All right, here we'll Missy. Western Pennsylvania is clearly a unique market for United Healthcare and dominated by two main provider systems, each of whom have their own health plans, kind of their unique thing that they have going on.
Yes.
What should Medicare customers choose United Healthcare as opposed to other provider plans? What makes UHC something that customers should want to be working with outside of just the brand name that everyone's usually familiar with at this point?
Sure. So thanks for the question. And yes, so we've all kind of been through the historical issues of the two main provider systems, right? But the great thing is that United Healthcare has always had contracts with both. So many of the agents, along with the consumers, chose us because we took the stress away because we always had contracts with both of the hospital systems. So they never had to have that worry. But in addition, to take it more to a national level, we are the number one Medicare Advantage company in the country, which I think speaks words. Along with, we are a Fortune 6 company as well. So we have the grassroots effect of being able to support and being the strength at a local level, because we do understand how vital a solid network is for many people to feel comfortable with any health insurance carrier. But we also take it to the national level, and we give them that extra core backbone of us being the number one Advantage company as well.
Yeah, and I think that's definitely true. I mean, even before I was involved in the business at all, everyone's familiar with United Healthcare, but then once you look at the nitty gritty, they have a lot at their disposal in terms of quality plans, and there's a reason why UHC has so much success. Now we're now recording this in early March, so and then I don't know when anyone's going to be listening to this, but it'll be out there for all eternity. But this past AEP, so going back to 2019, the fall there before the new year turned in AEP, how kind of was that for you, I guess? What was your product generated the highest sales for Medicare customers, and why do you think that was? And I do know from talking with different reps that came actually down to visit us here in the office that UHC put a major emphasis on kind of changing things and even improving things from where they were even a year ago, and kind of wanting
Yeah.
to correct things that they felt like were downturns in the market, and they did. It was kind of a mature thing for a top tier company. I'll say that you guys are having success. You always have. You've been around a long time and you're going to be around a long time in the future. But you recognize what maybe the customer and the agent didn't like, and you wanted to still improve further, which a lot of companies who are at the top and know they're going to stay there maybe wouldn't do. You guys did. But what was your major success from this past AEP?
So first of all, the reason why we made so many changes is because we do truly listen to our agents and value each and every one of them. And we take in, the pros and cons, and we listen. So what we did is that the plans that we have is a true full portfolio, specifically ranging from a MA-PD plan, an MA only plan, and then of course our dual special needs plan. And then we also have the extra option of our PPO plans, but the PPO plans are just up in Erie County only. So there's many moving parts to this, but I'd have to say that $0 speaks words here, right? And so we definitely came out with a solid $0 plan one MAPD plan that crushed it. The also too, with the $0 across the board for any PCP copay, that was a big change in which that we brought on for all of our plans this year, which is a great thing. But then, we do have that midpoint plan, which is our plan 2 at the $29, and that did not do bad at all either. So we had those two plans really crush it for the MAPD plan. And then in addition to that, we did add a additional $0 plan, and that is our newest PPO plan. But again, that's up in Erie, and that also came out with the $0 PCP. But the one item which many people joined on to that plan was because of the national network with over 800,000 doctors nationwide that they have access to. So I'd have to say with those 3 plus our dual special needs plan, I mean, I really don't know what else to say as I talk to agents and my team. And it's just like, we don't know what else you could really do with this plan, but we did it again. We added more coverage, added more to the debit card in the catalog. We added chiropractic. We added virtual visits for our dual plan as well, which we did not have prior. And then we also kept a lot of it the same. Actually, we kept it all. So you never saw anything in red on our dual plan. So I have to say, looking back, we had a solid turnaround for 2020. And anxious to see and have a feeling that we're even going to see that again and maybe even more for 2021.
Yeah, it definitely appears that way. And from looking at the changes that you guys did make, it definitely appears that you did listen to the agent and even listen to what the agent was receiving from the client and definitely made those necessary adjustments. And I think the big thing too, you hit on the $0 plans and success there, that a lot of people, I'm sure, and I even know this, people I just know personally, that when they see a $0 plan, they may think, okay, it's $0, but I'm not going to get anything. It's all everything. It's bare bones. But that's not the case. So
Yeah.
you definitely made sure that was not the case, even for a top tier carrier like yourselves. Now we talk to agents a lot. We definitely talk to agents a lot, and hear a lot of feedback, positive and negative, on a lot of different carriers. And they talk a lot about with United Healthcare, obviously what you guys are doing on the MA side and even MedSup, and just in general being a carrier that a lot of are working with, but also a lot on the ancillary benefits.
Right.
And there's great ancillary benefits on some of their 2020 plans. Now, for you, what do you think is the single most attractive benefit on the UHC plans that agents should kind of be pushing to talk to their clients? One benefit that they don't want to forget, because obviously when you're talking to a client, you're sitting at the kitchen table, there's a lot to say. You don't want to overwhelm them and tell them too much where they aren't going to remember it. But what's a benefit that you want to make sure they definitely get out and they do get that point across to the client?
So, Mike, in all honesty, I don't know if I can keep it to one because our ancillary benefits are so solid and strong, and the major part of why we did make a lot of our sales. And the first one that comes to my mind is our comprehensive dental. We have a robust and true comprehensive dental coverage with all of our plans. So it used to be where it was preventative only with some, but it's now preventative and comprehensive dental with all. And it is a solid comprehensive dental product. In addition to that, our vision and our hearing. So as we know that we hear a hearing aid costs sometimes just for one, like $3,000 to $4,000 a piece, right?
Yeah.
we did is we actually merged two companies, and now it's called United Healthcare Hearing, and it's a great thing because we, again, listened, no pun, right? But it's that now they can get a set of hearing aids for under $800.
That's
Um,
insane. That is insane because I know
and
what my grandfather had to go through to get hearing aids about 10 years ago and the cost of that and why he wanted to avoid it, and that's insane.
Right. And it's because, we, again, being number one within the country, we have those crucial partnerships that we can bring together so we can help everybody from helping the agent, but also our members and our clients know that they are getting the best of what we can offer them. And we are utilizing on what we can do as the number one insurer and bringing on the partnerships to help so we can give them better healthcare coverage. And then vision too, that's, something as well. Vision coverage is included with all of our plans. So they get a certain amount, just depending on which plan that they choose. And then two last things real quick is,
Sure.
our passport program. That is something that has always been vital to our product since we came back here. And the passport program is not going away. It's actually just growing, because anytime that we grow into more counties within any of the states that we are in, it's just expanding of that doctor network with the passport program, with our MAP PD plans. So that is not going away, and that is one thing that's huge. And then lastly, our tiers, our prescription tiers. We found out for the second year in a row that many of our tiers are at a lower level. And our tier 1 and tier 2 drugs are $0 for a 90-day mail order. And so we found that with some others, it was their prescriptions were at a tier 3, but then ours was a tier 2. So we were saving that member or possible client a lot of money each month, because that is something of what they have to have every day is their meds, right? So we are focusing on that. And the other changes too is that we also made it where the tier 1 could also be $0 at a retail site, which we made that change as well, because tier 1 and tier 2 used to be $0 just for mail order, which it still is, but we just added tier 1 is $0 at a retail site. So again, I'm sorry that I know you just asked for one, but I wanted to be fair and share, because just didn't want the agent to miss out on all those tips.
Yeah, no problem. Yeah, you guys have a lot at your disposal. Yeah, no problem at all. And I mean, the dental DVH for sure. Those are major things. I know, a lot of agents in the past may have had to add on some ancillary carrier because they maybe didn't like the DVH plan or something like that. You guys have improved it so much that really shouldn't be the case anymore, because you guys have pretty much everything that anyone else could dream of with
Right.
those plans. Now, the passport plan's interesting. I actually we got into that a little bit recently here in the office. Could you elaborate a little bit more on the passport program for anybody listening, just so they're
Sure.
kind of aware of how that works?
Sure. So the passport program basically travels with you, just like how you would utilize your health insurance that plan that you have local. So let's say, for example, if somebody purchases our plan here and they live in Greensburg, which is Westmoreland County, and they decide that they want to go to Florida or Georgia or Texas, just to name some of our states, they actually can go and travel with their plan, just like how they would use it up here for up to 9 consecutive months at one time. And how that works is that we just ask them to call in to our member services, let them know, hey, I'm going to go down to go see my family for 2 months in Florida. Here's which county I'm going into. Can you please activate my passport? And then what will happen is that they will then give a list of all the doctors, specialists, dentists, vision, everything that's down there, where again, they could utilize their hometown health insurance program, regardless on if they're traveling or not. And of course, life or limb threatening items are always covered, but this is just, if somebody wants to go and get a checkup, if somebody needs something done, it's that, they can keep up with everything of what they would do up here as normal, just within the same safety and comfort if they're traveling for up to 9 consecutive months at one time.
And that's major too, because there are a lot of people that they maybe go travel somewhere for a certain portion of the year, but they're not residents there. They're still residents here, but they go there and they stay there for a month. So that would be,
Correct.
yeah, that would definitely be a benefit to them for sure.
Yep.
Now, United Healthcare is a top tier carrier. Obviously, there's tons of success, and you guys keep on adjusting yourself to make sure you're the top carrier in the market. But in terms of selling UHC, as kind of advice to agents when they're sitting there at the kitchen table, there's a lot of other carriers that are also known now that are trying to improve themselves as well, trying to keep up with the Joneses here. So
Sure.
there's still going to be some challenges, and even in the Western PA market, there's going to be some challenges. Any suggestions or anything that you have, in terms of advice or strategies for the agent to overcome any of those objections that maybe you hear people say, well, you did this, but the client still is upset because of this, and advice you could give?
Yep. So my advice, and I actually put this advice across my team, and actually spread the advice throughout AAEP as well, is really focus on your clients every day, right? On their everyday health. We don't want to focus on that crystal ball moment. And what I mean by that is that, United Healthcare made huge changes to really help out that client take care of themselves every day, not only with making it easy with getting access to care, but also, with costs. So like how I specified prior, $0 PCP copays across, right? And that's huge because many people go to their PCP or specialist, right, versus a hospital, right? Everybody needs to take their meds every day. So that's the reason why, we looked at and made the change to better our tier 1 and tier 2 drugs to be both, stay at zero, but are $0 retail also. But in addition with, we are able to help out with those tiers. We understand, the crystal ball moment is like, hey, am I going to go into the hospital or not? We still have that hospital coverage there, but just to be upfront, it's not a per stay. We do have it per day, but I have to tell you that once you kind of look at everything from our cost of the $0 premium or $29, those are very low or no cost, right? And then with the PCP, and then with us lowering our drug coverage, it's that we are helping people to understand and helping them out with those costs every day, so we can ensure that they don't have to go into the hospital. I went to many sales meetings and programs, and I asked people to raise their hand. Hey, who has been admitted into the hospital this year? Of a group of people of like 15 or 20, maybe one person raised their hand. But then I asked them who went to their PCP, or who worries about their dental with teeth, and who worries about their eyes with vision, and who here takes meds. Every single hand raised in that room. And so I think that we need to focus not on just what's on paper, but focus on what we have for them. Because in addition to all of that, we also have many things such as house calls. So house calls is a nursing program that we will actually send a nurse to that client's home once a year. And we then also reward them for taking care of their health by then giving them a $25 gift card. Right. But then advocate for me and the risk assessment program. So we have the experts that can help, but also those resources where they can even do virtual visits. Snow, weather gets crazy up here, right? Where it doesn't get like that in Florida and so forth. So those virtual visits mean so much more up here to us, because sometimes I've had people miss their doctor's appointments because they couldn't get there because of weather. Yeah. And that just makes a huge difference to help keep our clients as healthy as what we can.
Yeah, and we've had a mild winter this year so far, but that's definitely
Don't jinx
normally the
us, Mike.
case here.
Please don't jinx us.
I'm sorry. Yeah, I'm enjoying it right now. I hope that the groundhog was actually providing us some positive news this year.
Right,
So
right.
so we'll see. But yeah, normally you can't rely on that, and that definitely is a concern for some people out there. Now I know that here at Neishloss we deal a lot with United Healthcare, and we have a lot of agents that work with United Healthcare. Just as kind of a tip to your agents that are working with United Healthcare that work with us, we definitely pride ourselves on service. Number one, I mean, we always have somebody available to talk to agents, whether it be throughout the day on the phone or a lot of us through email or other forms of communication, really through all hours. We make sure that we serve the client the best we can. And I believe what sets us apart from either other FMOs that Healthcare or any other carrier may work with is we have a in-house graphic design team that can help make business cards, billboards, posters, different things for websites, different things to really help an agent market and strategize. We provide that marketing strategy, but also the education. We will help an agent get contracted with United Healthcare. We will help them through the entire process and kind of act like a silent partner in that process, and we don't take any commissions from the client or hold anybody captive during that process. And what we're really doing now, which is part of even this podcast series that we have, is really ramping up the ability to help agents and assist them with a digital footprint and social media and things like that. Because without a digital footprint, without that ability to be there on social media, whether it be Facebook, Twitter, or whatever it is, for a client or wherever they maybe would read their news, because that is on social media these days, you're kind of missing out on leads. And you won't know how many leads you're missing out on either. So we have a program that will get them in touch with somebody who will get to know them as a person, help them create a website, help them create social media channels, post on those, kind of do that for them to take away the work so they don't have to worry about that in terms of their time management, or if it already exists, kind of ramp it up and still do the activity for them and make it better and help them get more sales and get more leads that they're missing out on. But number one, before all of that, but certainly including all of that, we definitely have the pride in our service and our communication with the agents, the fact that we're always there. So you have Missy at your disposal, you have us at your disposal. So I definitely think it's a great relationship, and it makes it even better when you have United Healthcare improving their plans the way they've done, and such a known name brand carrier. A lot of the time, it sells itself, and the clients are going to ask for these plans with UHC. But especially now that not only are they asking for something, and maybe not sure of what they're asking for because they just know the carrier. Now there's a comfort even more than before, but even then, that these plans are also the best in the market for them. So I think everything's a happy marriage and kind of working out to help serve the client who gets served by the agent. So that's why we do this podcast series. We help provide advice and help serve the agent to inform them on how best to serve the client, which is the goal for all of us anyway. Now, Missy, thanks again for joining me here on the program. Definitely hope to maybe do this
Sure.
again
Yes.
sometime. But
Look forward to
yeah,
it.
we're enjoying a spring-like atmosphere here in the winter. So maybe once the weather actually gets nicer, and it's going to stay that way. And I don't know if you know, but we're actually moving into a new office building. We'll have to have you guys come by and check it out here. It's only about a little under a month away. We're going to be moving into a new location in the South Point area here in Western PA. So we definitely have to have you come by. I think we're going to have some type of
Grand
party
opening. Yeah.
to
Sure.
welcome everybody. Yeah, I think maybe you've heard of it. So we'll definitely have to have you by there and have some drinks and talk about this. Maybe record another one of these. So thanks again.
Thank you, Mike. Take care.
And you too. Thanks. All right. Well, that was another edition here of the Neishloss podcast series. That one about United Healthcare here in Western PA. So that's a local flavor to where we are here because we're in Pittsburgh. That one with Missy Sipusic, the sales director there at the UHC Western PA market. And we got more of these coming. So until then, I'm Mike Asti. Until we meet again.